ring of veins which nerves are passing through, which nerves are leaving outside. So see here, superior rectus muscle raises the cornea upward and medially, depresses the cornea downward and medially inferior rectus muscle. So we will make one very simple diagram, and that simple diagram it will be very easy for you to understand what are the actions of the muscles and how they are going to work it. Okay, so if I draw here, see here, if I draw here the you can say the eye. Okay, so if this is the eyeball, okay, so this is the superior rectus, inferior rectus, this is the medial rectus, this is the lateral rectus. So you can easily tell to me, sir, superior rectus sections, it will cause the elevation of the eyeball. Inferior rectus, it will cause the depression of the eyeball. Medial rectus, it will place the eyeball medially, or it will cause adduction also. And lateral rectus, it will go in this direction, so it will cause what? Abduction of the eyeball. Abduction of the eyeball. If the eyeball is moving in this direction, this is known as intorsion. If it is in this direction, this is known as extorsion. Okay, now students make here a mistake how to remember all the actions of these muscles. So now we will draw here one diagram. So if you draw this diagram with me, then it will make your life very easy. For example, this is the nose of the patient and this is the eyeball. Okay, now write here superior rectus. So here you will write inferior rectus. Write here inferior oblique. Write here superior oblique. Okay, here it will be the medial rectus, here it will be your lateral rectus. Now see here, these are the directions. So if I am going to ask you what is the action of the superior rectus muscle, so you are going to say, sir, superior rectus muscle, it will elevate the limb, elevate the eyeball also, cornea also, and it will cause what? It will cause the medial or abduction of the eyeball also. Okay, so it will rotate the eyeball medially and upwards. Superior rectus muscle. Now see here, superior rectus muscle. What is the action? Raises the cornea upward and medially. So see here, superior rectus muscle. This is our superior rectus muscle. It raises the cornea upward and medially. Done. Inferior oblique muscle. It raises the cornea upward and it also moves the cornea laterally. Now see here, inferior oblique muscle. This is our inferior oblique muscle. Rotate the eyeball so that cornea looks upward and laterally. See here, cornea looks upward and laterally. So this is how you can make your life easier. One more action you can add here, intorsion and extorsion. So here I will write intorsion. So if I write here intorsion, it means here it will be extorsion. इधर मैं इसको उल्टा कर दूंगा, extortion, opposite, intorsion. So if I am going to ask you what is the action of the superior rectus muscle, so you can say, sir, superior rectus elevates the eyeball upward and medial and also cause intorsion of the eyeball also. Inferior oblique, it raises the eyeball upward and laterally it also causes what? Extorsion also. Okay, so this is how you can easily understand the muscles action of the eyeball. For example, see here, superior oblique muscle. Superior oblique muscle, cornea looks downward and laterally. So see the diagram. Superior oblique muscle. This is our superior oblique muscle. it push the cornea downwards and move it laterally. Nose, तो ये तो if eyeball is going in this direction, it means it laterally it is going, and it also causes intorsion also. So this is how you can understand the actions of the eyeball muscles. कभी भी आपकी, you will never ever going to make a mistake here. Okay, so this is how you can remember it. Clear to everyone? So just remember this diagram. If you remember this diagram, you will never ever going to make mistake. Okay. Now the nerves and their very important thing which